Great to virtually see everyone yet again. So December 17th, our Bloomfield Blueprint, our return to teaching and learning for the 2020-2021 school year. And we will start by looking at the COVID data as we have for the past several months. So looking at the most recent report that came out today, believe it or not, from OCHD, we're seeing the trends that are really great to see. We're seeing the numbers going down. We're about 2 weeks removed from Thanksgiving, and like everyone, we were extremely concerned if we were going to see another spike in cases. We still really need to see what the next 4 to 7 days are going to hold. But I'm grateful to report that the trends are either stable or going down in every age group across the board. Next slide. We've also started to see a decrease in hospitalizations. We're still about pretty much the same with the patients that are in critical care and patients that are on ventilators, but the overall number as far as the state trend is starting to shrink as well. Next slide. On a national level, we're starting to see it start to level off, hopefully just a little bit. Again, this is looking at a national lens. We know where we were on October 8th compared to where we are now in mid-December. Grateful that hopefully it is going to level off, but knowing that in Michigan, the numbers are on the decrease is still good. Next slide. Looking at our 7-day moving averages for both case count and percent positive. We're seeing a huge dip right now in case count. It's gone down substantially in the past 7 to 10 days. Also, we're starting to see a dip in percent positive and starting to move to that high end of orange and low range of red. Next slide. This one we haven't added for a while, and we're going to start adding it back in. It's just looking at the Oakland County detail a little different than what we get from the OCHD report. Again, seeing the 7-day average of daily cases is going down. Also being able to look at the ages by case group, by age group, and then the counts by day. Keep in mind that even on the Oakland County website, they do update, and there still is a lag, even though they're putting their numbers out. So you might see, today's numbers at 115, look 48 to 72 hours later, it might be 462, for example. Just again, trying to provide a little more data. Next slide. Again, just a reminder that even though we are in remote learning right now, we're still keeping the real-time COVID-19 dashboard up. So whenever a case is reported to us, it's automatically updated. So if people are going on to see if cases are still coming in, they are, and this is the best place to go and check for it. Next one. So there's been some updates or new guidelines for COVID-19 in schools. It's provided by Oakland County Health Division. It came in part from the CDC recommendation, and then the CDC recommendation went to the Michigan Department of Health and Human Services. In return, they worked with all the local health divisions to decide what parts of the new CDC guidelines they were going to update. Next slide. One is making sure that everyone understands the difference between quarantine and isolation. I know that's something that the Oakland County Health Division and the Michigan Department of Health and Human Services has really wanted to make sure. So isolation is for those who are sick with symptoms of COVID-19 and or have tested positive for COVID-19. And it begins on the day the symptoms appear or the day the test is performed. Quarantine is for those who have been exposed through close contact with someone who has tested positive for COVID-19. So what does it mean, close contact? Within 6 feet for 15 minutes or more, begins on the day of last known exposure. So you'll start hearing more often, not just from us, but from the Oakland County Health Division, whether or not someone needs to be in isolation or someone needs to be in quarantine. And that is the difference between the two. Next slide. So isolation and quarantine guidelines, these are new. So this is what's been endorsed based on Oakland County Health Division and Michigan Department of Health and Michigan Department of Health and Human Services, based on the latest update from the CDC. So isolation, 10 days, no change there. Quarantine, 14 days is still the gold standard because the incubation period of 14 days has not changed. New options. Quarantine may end on day 10 if no symptoms. but should continue to monitor for symptoms through day 14. OCHD and MDHSS do not endorse the 7-day negative test out option. That basically is that 7-day window, you go, you take a test, and if you, on the 7th day, if you test negative, then you can get out. And so that is not something that is being adopted in the state of Michigan or by any of the health divisions. Next slide. So why the decision to move from a 14-day to a 10-day quarantine? Michigan Department of Health and Human Services and Oakland County Health Division is looking at a couple of different things. One, the physical and mental health, as well as the cause of economic hardship that may reduce compliance. There definitely has been a compliance issue that they found in the state of Michigan based on that 14 days. So the hope is by reducing the length of quarantine, it will reduce the burden and hopefully increase community compliance because that is definitely an issue. Now, as far as what does that mean as far as people contracting COVID, turn to the next slide. You can see, quarantine plus symptoms, quarantine plus no symptoms plus negative test. If you look at the difference between day 10 and day 14, their thought is that with the 10-day, with this strategy, the residual post-quarantine transmission risk is estimated to be about 1% with an upper limit of about 10%. So that if you're not showing symptoms, the risk is greatly reduced. And they felt comfortable proving this as far as their new guidelines. Next slide. And that is the end of the COVID update. Thank you, President Cole.